So you might have a C-section, but how is anesthesia gonna work? You don't wanna be awake for surgery. Hillary. I am the pregnancy nurse and I'm the curly head behind the website Pulling Curls. I'm also the creator of the online prenatal class for couples. We are here to help educate you from bump to bassinet about having the confident, collaborative hospital birth that you desire. I am so excited that you are here because a lot of people have very misconstrued notions about anesthesia and C-sections. So let's talk about how C-sections work and how you might not feel the pain of the C-section, because that is our ultimate goal, right? But before we get started, if you are interested in information about your upcoming delivery, be sure and like this video, and while you're down there, just hit the subscribe button because it helps other people learn more about their delivery as well. Okay, with a C-section, you basically have two different options. The first option is a spinal. You could also have an epidural, but to you and me, that looks exactly the same. It looks different for anesthesia, but pretty much they're the same. The second option is general anesthesia, which is what you envision when you go in to have surgery, where they put the mask over your face and you go to sleep. Now, a lot of people really want to be put to sleep. They can't imagine being awake during surgery. And honestly, I'm right there with you. If they were replacing my knee or my hip or whatever, I do not want to be awake for it. I 100% get that. But let's talk about the pros and the cons of each one so that you'll have an idea before you go in for surgery. Let's start off with spinal anesthesia. The big pro is that you're awake. Now, I know you're saying you don't want to be awake, but you're awake to see the birth of your baby. You're awake and your partner can be right next to you and you can share that moment together. A lot of people who end up having a C-section feel cheated out of that moment with their partner and the new baby because partner was invited and all those different things. So being awake and having your partner there so you can see the new baby and know like everything's happening, it just ends up having a better experience overall, even if in your brain that is a con. One of the biggest pros and why anesthesia actually likes it is that it gives you extended pain release. So when they put in the medication, that medication lasts for almost 24 hours and it really is focused right where you had the C-section. So it will wear off, you'll start to be able to move your legs and bear weight and things like that, but you're gonna have great pain relief still in that area where you had the C-section, which is awesome because you want to take less pain meds. It's not awesome for you to be taking oral pain meds or IV pain medications. We want to keep you happy, but also this allows you to not have those extra medications in your system. And finally, with a spinal anesthesia, no medication gets to the baby. Similar with an epidural, the blood-brain barrier stops the medication through getting through the placental barrier. There's so many barriers. Anyway, medication does not get to the baby. Let's talk about some of the cons of spinal anesthesia. The first one is that you're awake. Like we said, that it can be a pro and it can be a con. Now, I do want to remind you guys that if you are awake for the spinal anesthesia, and once baby is out, they can give you medication if you're just still so anxious or you want to go to sleep or all those different things. They just don't give it ahead of time because we don't need baby being asleep when we pull them out. So being awake or asleep, pro, con, all those different things. And I think that's what most people think about in their head, but honestly, with the spinal anesthesia, the main thing you want to think about is that pain relief that we talked about earlier. The other final con of spinal anesthesia is that it can be difficult to place. Sometimes we end up having to do general anesthesia because of anomalies in your back anatomy, issues just with the anesthesiologist being able to place the spinal anesthesia. So it is a little bit more difficult than general anesthesia for them to place, but most often we don't end up having a problem. I've probably only seen them have to switch to general anesthesia once or twice in a 20-year career, so it's not something you really have to consider, but it can be more difficult to place. Let's talk about general anesthesia. Now, this is the one where they put the mask over your face, they count down, all those kind of things. One of the pros is that you're asleep, if that's a pro to you. But the other thing is that anesthesia is really good at it. Like, that is what they're used to doing in the OR and in the ER and all those different things. Like, that's their thing. They're really good at it. It's pretty darn easy for them. And so that's a benefit as well. Cons of general anesthesia is that you're asleep. Also, when we put the tube down, there can be like soreness in your throat or some raspy voice as you kind of get through. There is a tube that goes down your throat, and some of that sore throat symptoms and things like that. So that is a con as well. General anesthesia tends to have higher risks because more drugs are involved. Again, that tube going down into your airway, there's just higher risks with general anesthesia than there is with spinal anesthesia. Now that doesn't make as much sense because I'm saying that anesthesia is really good at general anesthesia, but there are just higher risks because of the drugs that are involved and the airway management that they use. Now, when they give you those drugs to put you to sleep, that does mean that baby gets some of those drugs. So baby getting some of those drugs is one of the cons of general anesthesia. You just want to be mindful of it. The reality is that when we put you to sleep, the obstetrician very quickly gets out that baby. And so it is a quicker process. And anytime anything's a little bit quicker, it's maybe not quite as good. Although those obstetricians are really trained to get that baby out very quickly in an emergency situation. This wouldn't be considered the same as an emergency situation, but it is quicker than when we have spinal anesthesia on board. So that's something to be aware of as well. So there we have it. Those are your two different options. Now everyone's desires are different, but if you go in saying you want general anesthesia, your anesthesiologist may not be willing to do it. I have seen some say, no, I won't do general anesthesia on you because of those increased risks. They are a doctor, they have a license, that's their choice. So that's something to consider as well. If you are planning on a scheduled C-section, I would definitely talk with your provider. Sometimes you can get a consult with anesthesia ahead of time so that you can kind of talk through your fears and your feelings and kind of get their opinion before you go in for the surgery. Anyway, there's just the two different options. So talk with your provider, see what they're going to recommend. Remember, 1/3 of people really end up having a cesarean section. So this information is good for anyone, no matter if you're planning on a C-section or planning on a vaginal birth. So I hope you liked this video. It was aimed to be really helpful to you. If you did, give it a thumbs up and subscribe while you're down there. And I think you're gonna like some of these upcoming videos as well.